let's take the main domestic concern of Americans. For decades, the major domestic concern of Americans, or either top or very close to the top, has been the health system. Okay, that's obvious why. It's a total catastrophe. It has about twice the per capita costs of other industrial countries, and has about the worst outcomes. And like 50 million people either don't have insurance, or many more have much too limited insurance. Now those are things that really hurt people. They're not abstract. Drug prices are like 2 or 3 times as high as in comparable countries. That hurts people, and they care about it. And furthermore, people have consistent ideas, consistent beliefs over a long period. And on this issue, they have very consistent beliefs. For decades, a large part of the population has been in favor of some kind of national health care system. It's called here single payer. It's called Canadian style. The reason it's called Canadian style is because people know that Canada exists. And it's not called Australian style, which is a better system, because who knows what they have in Australia. But there's just been overwhelming support for it. And it would almost certainly be much cheaper than the system we have now. In fact, if you take the socialized part of the system, Medicare, its administrative costs are like a fraction of the privatized system. I mean, there's constant talk about the problems that Medicare is facing down the road. We've got to do something about to stop it. Yeah, that's true. But the problems are because it has to work through the privatized system, which makes it highly inefficient, costly, bureaucratized, a lot of intervention, and so on. Well, the public has wanted something that makes sense, but it's not on the political agenda. Okay, very few people know that that's what everybody wants and know the reasons for it, because it's not discussed. Okay, that's a pretty impressive achievement to have suppressed for decades. It's not that it's like everything I said, you could find the data in the papers, but you got to research it. But here's a situation where there's a major domestic concern. Population has a lot of public support. If it was even discussed publicly, the support would grow much higher. When things are not discussed and debated, people may have an opinion, but their feeling is, well, I must be crazy. Nobody else believes this. If it was part of an ongoing, lively debate and discussion, as would happen in a functioning democratic society, then people would see the reasons for it. They'd be reinforced, and you'd have public pressure. Now, up until 2004, these ideas were never on the political agenda. So you go back to the 2004 election, Kerry-Bush election. Take a look at the debates and the coverage. The last debate, right before the election, was on domestic issues. You go back and take a look at the New York Times or the Washington Post the next day. They point out correctly that Kerry never suggested any government involvement in the healthcare system because it is politically impossible and lacks political support. Okay, the only support it had was the large majority of the population, but it lacked political support and was politically impossible, which means the insurance companies didn't like it, financial institutions didn't like it, pharmaceutical corporations didn't like it, and so on. In fact, shortly after that, Congress passed legislation which made it illegal for the government to use its purchasing power to negotiate drug prices. I think the United States must be the only country in the industrial world where anything like that is true. So like the Pentagon can negotiate prices, to get paper clips, let's say, but the Medicare can't negotiate to get lower drug prices. Well, now a Medicare program was created, which is just a gift to the insurance companies, since only the Democrats voted for it. All right, this year, in 2008, something changed. For the first time, the Democrats began putting forward programs which are towards what the population has wanted for decades. They don't really get there, but at least they're in that direction. First Edwards, then Obama and Clinton. Well, what happened between 2004 and 2008? Public opinion didn't change. It's been pretty much the same for decades. What changed is that manufacturing industry started coming out in favor of a national health care system because they're being smashed by the costs of the privatized system in the United States. Like General Motors says it costs them over $1,000 more to produce a car in Detroit than across the Canadian border because they have a rational healthcare system, more rational, not perfect, but better. Well, you know, when a sector of concentrated American capital becomes interested in something, it starts to become politically possible and have political support. You know, these are things that people ought to be discussing and think about. What does that tell you about functioning democracy? That something can become sort of politically possible, even if not what the public wants, only if a major sector of concentrated capital is in favor of it. You know, these ought to be topics that are, you know, main issues for people who want to create a functioning democratic society. And that's the major domestic concern. Now, if you take a look at Obama's program today, it's being criticized because it's going to be expensive and we can't afford it. Well, yeah, the way he's planning it, it's going to be expensive because it's maintaining the privatized system. And in fact, the privatized healthcare system is complaining bitterly right now because if there's an option of a public system, as is written into the program, they won't be able to compete on a level playing field. That's a way of saying we're so inefficient and costly that we can't compete with a national healthcare system, so it's unfair. And Obama's proposals, such as they are now being tinkered with to help the costly, inefficient privatized system compete on a level playing field. Why should the population allow any of this to happen? Okay, there's a topic, a very different one, on which popular organizing can take place and should have been for decades, and in fact would have been if democracy was functioning.